Committee meeting, August 29th, 2023 at 9 a.m. We will proceed with our first item of business this morning, which is a call to order and the roll call to establish quorum. Ms. Rodriguez, I'll turn it over to you to establish quorum today.
Thank you. Senator Fabian Doniate.
Here.
Jessica Johnson.
Present.
Debbie Nadler.
Present.
Angela Nichols. Eric Schoen.
Yes, I'm here.
And Senator Heidi Sievers-Gansert. All right, Chair Johnson, we do have a quorum.
Fantastic. Thank you all so much. I may just stay off mute unless I'm too loud today. Apologies to everyone. Wonderful. Let's move to our second agenda item, which is public comment.
Sure, I can just read the slides if that works for you.
Fantastic. Thank you, Ms. Rodriguez.
So public comment will be received via Zoom by raising your hand or unmuting yourself when asked for public comment. Public comment shall be limited to 3 minutes per person. This is a period devoted to comments by the general public, if any, and discussion of those comments. No action may be taken upon a matter raised during a period devoted to comments by the general public until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241020. So if you're dialing in from a telephone, you can dial 1-253-205-0468. And when prompted, enter the meeting ID, which is 825-0031-7472. And please press *9 so the host can prompt you to unmute. And Chair, I see one subcommittee member with their hand raised.
Wonderful. Ms. Nadler, you've been recognized for public comment. Go ahead.
Thank you. Yes, I just want this down for the record. So I started researching the Nevada drug control update, and I went all the way back to 2009 to 2010. And Nevada was one of the top 10 states for rates of drug use in several categories, explicitly teenagers ages 12 to 17 for use of illicit drugs other than marijuana. And we were the highest in the whole country. Oh, sorry, I heard somebody. With teenagers ages 12 to 17 with the use of pain relievers. And everything that I'm reading, and you can find it on the Nevada drug control update from the White House records. So I started going through every year, and I just think it's so important, especially after reading everything I have read, that we really do something with primary prevention here. I mean, starting back in 2009, I'm sorry, it's my dog. Starting back in 2009, we had the highest rate of teenagers, and it's steadily gone up. So that's my comment. We have got to get these kids. We have got to educate them.
Thank you for your comment, Ms. Nadler. Ms. Rodriguez, do we have anyone else for public comment?
Chair Johnson, I do not see anybody else at this time. And I just wanted to note for the record that during this public comment period, I admitted another prevention subcommittee member, Angela Nichols, from the waiting room. So I don't know if we need to formally call roll or if that's enough.
Oh, good question. Wonderful. Is the DAG on the line who could help advise us if we need to go back to roll call?
You don't need to. You had a quorum to start, so you don't need to go back to roll call. Just noting on the record that you have an additional member here.
Wonderful. Thank you so much. Thank you so much, Rosalie. Appreciate it, helping me learn Robert's rules one meeting at a time. Wonderful. With no additional public comment, we'll close agenda item number 2 and move to agenda item number 3, which is review and approve the minutes from our July 17th Prevention Subcommittee meeting. Hopefully folks have had a chance to review this in advance. And with your permission, I'll entertain a motion to approve the minutes.
Chair Johnson, this is Eric, shown for the record, so moved.
Wonderful. I have a motion to approve the minutes. Do I have a second?
Debbie Nadler for the record, I'll second.
Wonderful. Thanks, Ms. Nadler. A second from Ms. Nadler. All in favor say aye.
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 Any opposition? And any abstentions? All right, the minutes from our July 17th subcommittee meeting have been approved. Let's move to agenda item number 4, which is a review of the 2022 Prevention Subcommittee recommendations, review and discussion. I'm going to ask Ms. Rodriguez to explain the handout and sort of the approach for agenda item 4.
Thank you, Chair Johnson. So as folks should be able to see on the SURG website, there was a handout that was posted that it has several columns. The major thing we're hoping to get from this handout is to get a sense of the 2022 prevention recommendations, what action has been taken, if any, so far since the last report. And that's an important exercise so the subcommittee can then decide if they want to reconsider any of these recommendations. So in the handout, it's called the Prevention 2022 SURG Recommendations Status as of July 2023. You'll see the recommendation. These are just the ones that came from the Prevention Subcommittee. The action step that was outlined in the 2022 report, then any legislative updates, ACRN grants, or policy work that we were aware of that happened. And then the Bureau, anything that the Bureau was able to comment on as far as other updates that they were aware of. So we thought that hopefully that would be a good starting point for the subcommittee. And so I believe today on the next couple of slides, we have just the language of the recommendation. You'll have to refer to the handout to see if they're to see the additional details. But the idea would be that folks could go through the recommendations, identify if there's any additional information to add about the status of the recommendations. And then given the status, do any of these recommendations warrant a revision and a resubmission? And then if the subcommittee does decide they want to resubmit any of these, then elect a subcommittee member who will then submit that as a survey response. So we have all the information we need going into that October SURG meeting for the final draft of the report.
Apologies. Thank you so much for a summary, Ms. Rodriguez. So today, subcommittee members, I'm hopeful that we can consider each of the recommendations on the report. I know Emma has prepared them on the slides. So I am just going to have you scroll back, if that's all right, Emma, to the recommendations. And my hope is that we can go by each recommendation, and I'd love to hear from the subcommittee members as you review the prepared information. If this is a recommendation given the status that we would like to revise and resubmit, or if we will not be including it in our 2023 report. So we can start with the handout recommendation number 2, which is to support a backbone agency that specializes in data collection, evaluation, analysis, and assessment, and provides consultation to entities across Nevada to help improve internal local data collection systems and create a comprehensive statewide data sharing system that includes all state dashboards and public data. So based on the status, do subcommittee members want to move on from this, so to leave this in our 2022 recommendations, or would you recommend a revision or a resubmission of this particular item given the status?
Kara Johnson, Eric Schoen for the record. I actually think with the Office of Analytics doing what they do, and it feels to me like they have some momentum and support, more so than they had before. I'm not sure we need to continue this one. I feel like we were able to sort of make sure that we emphasize that this was important, which we accomplished that. And I think we are not the only ones invested in making sure that we have a strong Office of Analytics. So I think this one will probably, the momentum will continue in the direction that we want without us continuing to have it as a recommendation. If that makes sense.
Yeah, thank you, Mr. Schoen. I agree with that recommendation, and I believe in this year's 2023 recommendations, we have some additional data points for consideration. So I can see those being included in lieu of this kind of broader recommendation. I don't see any additional hands up for feedback, so I'm going to move to recommendation number 3, which is to support prevention and intervention in K through 20 schools by investing in the multi-tiered systems of
Oh, awesome. Thank you.
support. And provide a robust platform of services at schools to connect families to pro-social education, early intervention, counseling services, and other resources to help mitigate adverse childhood experiences. In our, Ms. Nadler, before I take your comment, I just want to mention in our current recommendations, we do have a recommendation around funding for prevention initiatives, and we'll hear more on that presentation on that at our September meeting. But wondering to hear from you all if we should additionally move recommendation number 3 forward. Ms. Nadler, you have the floor. Debbie, your phone is cutting out for me.
I can't understand her either.
Is it? I'm sorry. Can you hear me now?
Yes.
Okay, I'm sorry. I heard that we're going to get a big COVID thing again, and just to be prepared for it, is there something we could add to the prevention to this where there's something done via the internet if our kids are stuck at home again? I just saw a whole big thing last week about it. I mean, just kind of a preventative thing, something we can add, like online services or something to this. I'm worried our kids are going to be locked down again.
Thanks for your question. Eric, are you familiar at all with the multi-tiered systems of support if they move to online schools or support?
So I am familiar with this, and I think I wanted, if you don't mind, I'll just sort of, my general comment on recommendation 3 and 4 has to do with making sure that we continue to emphasize prevention going forward. And in your opening comment, when you talked about recommendation number 3, you reminded us that we do indeed have a prevention recommendation for 2023 that I think will help us to continue that work, and I think would probably be the forum to talk about what that might look like. So Debbie, I think that would probably be the place where we could start talking about what that might look like and what we could be ready for, depending on what changes on the ground. specifically with MTSS, when we first made this recommendation, I wasn't thinking of this as the formal MTSS program, even though we receive funding from MTSS and we provide all of these services. I was thinking about this more broadly and more generally. And yes, while I feel like a good start has been made, I think I agree with Debbie. We need to continue to keep our foot pedal to the metal and make sure we're making progress on this. And if we have that recommendation already in 2023, I don't think we need to make the specific recommendation for MTSS specifically going forward.
Thank you, Mr. Schoen. I appreciate your feedback there. Other thoughts from committee members on recommendation number 3?
Sorry, Jessica, if I could just, I couldn't raise my hand. In recommendation 3, are we including the mental health aspect of it or with the prevention, because it goes hand in hand? Did we talk about mental health services, certified mental health counselors going hand in hand with the intervention and the drug awareness and everything else? Because I'm just seeing our state has a higher degree of suicides with these young kids. You know, suicides go hand in hand with the drug use. I mean, it all goes hand in hand. And if we could do some kind of emphasis on the mental health for the youth as well. Sorry.
Chair Johnson, if I might just, Eric Schoen for the record. So Debbie, we provide this service in both Mineral County and Lime County. And yes, mental health is a key component of the services that are provided to both the youth as well as the family. So yeah, to your point, and you're spot on, you're super observant to recognize the relationship. And yeah, we definitely have to pay attention to that too.
Thank you both for your input. With that, it looks like we can move to recommendation number 4, which is provide age-appropriate, innovative, and/or evidence-based prevention education and programming that is based on best practices and invest in certified prevention specialists in schools. It does look like from the Bureau's actions that there is some evidence-based prevention education that is provided by the Department of Education Bureau of Health Liaison. I am wondering if, again, if this recommendation doesn't dovetail with our other funding recommendation from this year's from the 2023 set that we've created. Looking for committee input here, Mr. Schoen, and then Ms. Nadler, I see your hands up as well.
Yeah, Chair Johnson, Eric Schoen for the record. I would agree with your analysis of that. So given that I think we have that as a focus for 2023, I don't think we need to continue specifically recommendation number 4.
Thank you, Ms. Nadler.
Yep. And excuse me, because I don't remember what it's called. It's called SNAP. It's called something with an S. I was going through thousands of documents this weekend, and it looks to me that there is a trial. There's some kind of program being done in in most of the big counties except for Clark. It's a trial program they're doing in the schools, an evidence-based program. And I'm just wondering why Clark County, with the biggest population, does not have something like this. I know Washoe, I never say it right, I'm sorry. And all the other counties, but ours is not included. And I can't remember the program. It starts with an S, and I apologize. My dog ate my papers today. It's called something with an S, SNAP, or not SAMHSA. It's something they're doing up north, but they're not doing it down here. And I feel like kind of Clark County is being overlooked in everything I'm reading. And I'm wondering why this is. There is nothing in our schools. And I've talked to teachers, I've talked to principals, I've talked to so many people. It's not in Clark County schools. The ID cards are not. They are up north. DARE, they're doing DARE up north, and they're not doing it down here. There's another service they're providing up north. They're not doing it down here. And I don't understand it.
Thanks for your input, Ms. Nadler. I appreciate this opportunity to dialogue a little bit more in ensuring that we have kind of comprehensive coverage of prevention programming. My recommendation might be for it sounds like this is a separate 2023 recommendation and not necessarily a revision of what we proposed in 2022 or an enhancement. If that's a recommendation to for the SURG subcommittee to reach out to either the school board or what other entity is doing programming, particularly for Clark County schools, to learn a little bit more. That might be a recommendation for 2023. But I to Mr. Schoen's earlier point, I do think that I agree with him that what we have for the 2023 recommendation around identifying additional funding sort of moves what we currently have for recommendation number 4 into that next iteration.
Okay.
So if the committee's all right based on time, I'm going to move to the recommendation number 6. These really the goal of this exercise is to identify if there are things that we want to move into our 2023 recommendations, as Emma mentioned at the outset. So recommendation number 6 is expand Medicaid billing opportunities for preventive services and allow blended and braided funding to facilitate services to expand access to care for youth and adults. We received a presentation on the Medicaid demonstration waiver at the the July SURG meeting, I believe. And that's what's been demonstrated as some of the policy work around this. I'm curious to hear from the committee if this is a recommendation we want to keep or we'd like to move forward from.
Here, Johnson, Eric Schoen for the record. If somebody has more knowledge than me, please correct whatever I'm about to say, because I don't mean to speak unfactually. But I do believe that there's some momentum on this on at least 2 different fronts. One, community health workers should soon, by that I mean between 6 and 12 months, probably have all of the necessary legwork done within Medicaid itself to allow billing for community health workers helping to provide services in the context of mental health, which will be helpful. And then I do believe there are conversations and there's movement under, Fabian looks like he might know. Fabian, did you want to jump in? Okay, I'll just go to the second one and then maybe
sure.
Oh,
sorry.
ahead. No, go ahead.
I was in the process of trying to lower my hand if it's okay, Chair.
You've been recognized. Go ahead.
Thank you so much. That is correct. So over the last legislative session, we did increase the opportunity for community health workers to no longer be supervised just by physicians. We expanded the provider definition so that more individuals could qualify for it. But where I see this also benefiting is we did start the conversation of community-based centers, perhaps funding centers that provide primary care services at school facilities, and that was a conversation that did not complete, and most of it came down to appropriate funding mechanisms. And so I think that recommendation 6 is still relevant because the legislature is still planning to tackle it perhaps in the future session.
And then Chair Johnson, I would just add my understanding, Senator Dunyate, is that there was sort of a carve out created for schools such that Medicaid services can be billed within the school system, and that does not draw down or compete with services outside of the school system. Well, regardless, we're making progress on this, and there are a lot of people who I think are committed to seeing this happen. And to your point, with respect to input on this, I don't think we need to carry this forward.
Thank you so much, Mr. Schoen. Senator Dunyate, based on your input, would you recommend a revision of this particular one to address the primary care centers, or would you instead recommend a separate submission for the 2023 recommendation?
Thank you for that. I think based on my current opinion, it probably makes sense to keep it as is. In terms of how it moves forward in 2023, I don't know. I think I don't think there needs to be any revisions to how it's structured right now, because primary care is, in my opinion, a level of preventive services. So I think the recommendation is fine as is. If we want to move it forward, I think that would be something that I would be supportive of.
Wonderful. So it sounds like your recommendation is to carry recommendation number 6 forward into the 2023 recommendations, so that we can look for expanded action around some of these services and access to care for youth and young adults, if I'm catching that correctly.
That's correct.
Great. Ms. Nadler, I see your hand up.
Yeah, I'm sorry. I had a question about that. With the Medicaid, and this might be off topic, I don't know if it relates to this, but will Medicaid step in if they see somebody, for instance, going from doctor to doctor and pharmacy to pharmacy filling prescriptions? Will Medicaid step in and interfere with that? Because I've been presented a situation, my son's best friend is suffering from addiction and getting away with going from doctor to doctor. He's on Medicaid right now, and the pharmacy didn't stop it. They're dispensing it. And I've already called the pharmacy board, but I know he's on Medicaid. So does Medicaid have something where they step in, where they see if somebody's abusing and reporting it? Or because so far the doctor's doing it and CVS is filling his prescriptions, and I can't believe we don't have a flag.
Thanks for your question, Ms. Nadler. I don't know the answer to that question. I don't know if one of the chair committee members is able to answer that. All right.
That's a
not seeing anyone.
That's Attorney General Ford. Okay.
Thank you. All right, so we can move recommendation number 6 in forward into the 2023 recommendations. Do I have a subcommittee member who would be willing to champion that and complete the survey form?
Hey, Chair Johnson, I'm sorry. The survey form, I must have missed something. What's the survey form?
Yeah, my understanding from Ms. Rodriguez is that if we identify a recommendation that we'd like to resubmit for 2023, that we'd need to complete the form that we've completed for the other recommendations for this particular year. Ms.
Okay.
Rodriguez, is that correct?
Yes, Emma Rodriguez, for the record, that's correct. And I think that's especially important if you were going to add any additional justifications. So you could add stuff from the conversation you just had, you know, just to try to explain why you're resubmitting it, why it's still important. So we can distribute that survey link. And a lot of the information you can pull from the last annual report, but we just want to have all of the information in one spot so that way we can post it for the public and the subcommittee to review.
Okay, thank you. So I'm happy to take a stab at it, but having said that, I think Senator Doñate would be the most knowledgeable for doing this. May not have the time, but I don't mean to volunteer him, so.
Thank you, Mr. Schoen. Senator Doñate, your thoughts?
I'll take a stab at it, but we'll see if I can complete it. We'll work together for it. How about that?
Sounds good. Okay, perfect.
Wonderful. Thank you both for the time and effort on recommendation 6. Fantastic. Let's move to handout recommendation 7. Thank you. This is a harm reduction based recommendation. I know in our 2022 recommendations, we took a little bit of a different approach than we've taken this year in 2023 around harm reduction recommendation. This one was looking at utilizing opioid settlement dollars to designate a baseline level of identification and overdose reversal medication for the next 10 years in Nevada, looking at naloxone saturation plans across throughout the state. So it does look like there's been some ACRN funding that was identified for naloxone, fentanyl, and xylazine test strips that's been reported, and that the state has increased their orders for the specific test strips that were mentioned. So interested to hear from folks if this is a recommendation we'd like to include in 2023, or if we'd like to move on from it. Debbie, your hand's up. Go ahead.
I'm sorry. The only thing that I'm still concerned about is in legislation, when they supposedly mandated it in all the schools, they use the word shall instead of must. So half the schools are using it, half are not, because it's by choice. So I don't know how we do this, but if the legislator could just change one word and say must instead of shall, which I think I've repeated several times, all the schools do not have it.
Thank you. To clarify, Ms. Nadler, I believe you're referencing a piece of legislation around schools carrying an opioid overdose reversal medication on site.
Yes, yes.
Wonderful. I read this recommendation more about looking at long-term sustainable funding for overdose reversal medication in the state. To your point, I would welcome that recommendation for the 2023 recommendations by completing the survey form, is what I'm going to refer to it as, for lack of a better word. For 2023, that could be something our committee entertains for that part. Thank you for bringing that up. With regard to this specific recommendation, number 7, but just my thoughts are that I can see that additional resources have been allocated not only for naloxone, fentanyl test strips, and xylazine. My observation is that I would love to know sort of what the sustainable kind of stable planning is for these resources for the next 10 years. I am aware that there's a state naloxone saturation plan, but what the piece that's sort of missing for me, and I'm happy to assign myself recommendation number 7 revision, is to look at what this baseline level of funding looks like that is beyond if grant dollars or other sources of funding. So from my reading of this, it looks like that ACRN is allocating some of this, but then SAMHSA is included. So I'm a little unclear as to what the specific progress is on number 7. Open to the committee's thoughts if there are any additional considerations here.
Chair Johnson, Eric Schoen for the record. I think the best thing I heard out of all of that is you would be willing to take a crack at this for refining it for 2023.
Thank you, Mr. Schoen.
I agree, Debbie Nadler.
Thank you. Thank you, Ms. Nadler. All right. Without any further discussion on number 7, I'm going to move on to number 8. This one is around requiring DHHS to allocate increased funding for the prevention coalitions and to set aside funding for small grants to programs and grassroots efforts geared towards substance use prevention and education. There are some updates on this particular one around the Partnership for Success grant and some funding cuts that were experienced under the Bureau's notes. My initial thoughts on recommendation 8 are that this is again addressed in our 2023 recommendation around funding for primary prevention, but open to the committee's thoughts on recommendation 8.
Eric Schoen for the record, I'm comfortable with not moving this recommendation forward.
Fantastic. Any other discussion from committee members? All right. It sounds like we have a decision there. Number 9. We did a lot of work in 2022. Had a fantastic chair last year. All right. Number 9 is around supporting harm reduction through a recommendation to the legislature modeled on Maryland STOP Act, which authorizes certain emergency medical providers to dispense naloxone to individuals who receive treatment for a non-fatal overdose or who were evaluated by a crisis team, and requires certain community service programs and hospitals to have a protocol to dispense naloxone to folks for free of charge under certain circumstances. So it does look like our legislative update was an endorsement from DHHS for rural emergency hospitals to serve as crisis stabilization centers, providing behavioral health services and leveraging Medicaid. Other updates in the provided form include approve certain projects such as the Most in Crisis Response Team that have, I guess, similar goals. And subawards were allocated for the hospital objective. Again, in my reading of, go ahead. Open to committee discussion. Mr.
No,
Schoen.
actually, I was Chair Johnson, Eric Schoen for the record. If memory serves, this was primarily your articulation, so I'd be curious to hear your analysis first.
Wonderful, thank you. While I do really appreciate the updates that have been gathered here, and to Ms. Rodriguez's point at the outset, this is sort of the best research done to date by their astute team at SEI. I would move to I either revise recommendation 9 specifically around where we could allocate naloxone to folks who are experiencing non-fatal overdose or evaluated by a crisis team, folks that we know are at risk for a fatal overdose based on the data, and reports by individuals in the community where naloxone reversal is happening. So to my knowledge, while I can very much appreciate the work that has been done around the crisis stabilization centers and other behavioral health supports, from my perspective, that this still warrants additional attention and discussion. Ms. Nadler, I see your hand raised.
Hi. So as far as number 9, would that include doctors prescribing opiates of any kind, giving their patients the reversal, or when someone is released from prison? Because already I've seen a couple overdoses from people, a lot from people being released from prison. They have nothing, and we all know most will go back to using and are in the streets. I've encountered quite a few. So, and especially doctors prescribing it, are they giving their patients the naloxone with the pain pills?
Great questions, Ms. Nadler. I don't know that I'm the single source authority on all of those questions. They're fantastic questions. This initiative very out of the way that my understanding of how Maryland conceptualized it is that it was very much focused on emergency medical services, individuals responding from a crisis team, and then other programs and that are working with folks who are in treatment or in temporary housing situations in addition to hospitals. So I I'm happy to also, again, to assign myself a revise and resubmit of this one. And perhaps Ms. Nadler, we could work together offline for additional sources such as individuals being released from incarceration. I'm briefly aware of a few programs that are doing naloxone, specifically leave behind, but overdose reversal medication leave behind in when folks are released, but I'm not, to my knowledge, sure how widespread that is. So open to those pieces. To your other question regarding prescriptions for naloxone when folks are issued an opioid or pain treatment, an opioid-based treatment or opioid prescription. From my perspective, it's a little outside the scope of this particular recommendation, but something the prevention subcommittee could consider. I know there's a long history to to that particular initiative, but I'm not recalling all of the details off the top of my head. So we could get some more
Thank you.
information about what's been worked on for that
Yeah,
particular
thank you.
comment.
There's a lot of gaps. I mean, we have a lot of gaps, obviously, but yeah, I've been seeing it. Unfortunately, like I said, it's in front of my face right now. So yeah. Thank you.
Yeah, thank you, Debbie. So I would recommend if you can complete the survey with that recommendation, then we can work with the SEI team to see who could provide insight on that. Emma,
Thank you.
you've been recognized.
Thank you,
Ms.
Chair.
Rodriguez.
I just wanted to make a note that I've heard a couple subcommittee members mention that they'll work offline with each other potentially. And I just wanted to get guidance from Rosalie on avoiding serial communications or anything that might be in violation of open meeting law. So Rosalie, do you have any guidance for how subcommittee members can work together or if that's allowed outside of these meetings?
So long as the subcommittee as a whole isn't kind of assigning a task to a couple subcommittee members, they're just assigning separate tasks to each subcommittee member. If they end up working with each other a little bit, that's fine. Just the caution to any members is that be careful with any conversations you're having, such that on any particular topic, you don't reach a quorum when really discussing or deliberating on those topics, because that's where you would reach open meeting law problems. The same would be if the subcommittee group as a whole says, okay, these two people go do this task and come back to us, then you're effectively creating yet another subcommittee.
Thank you for that guidance, and thank you, Ms. Rodriguez, for ensuring that we're following the open meeting guidelines. So ensuring that those conversations are remaining within the confines of the group. Appreciated that. All right. Moving to the final component of this, recommendation number 15. This is around implementing changes to recruitment, retention, and compensation of health and behavioral health workers to align with the Commission on Behavioral Health Board's letter. And we wanted to continue to sustain and expand investment for community health workers, peer recovery support specialists, and certified prevention specialists. Open to, looks like there has been quite a bit of legislative work that addressed recommendation 15 and open to the subcommittee's input on retaining or revising this one.
Chair Johnson, Eric Schoen for the record. I would volunteer myself to take a crack at updating this. So excited to see all of the progress, and we should rightfully be, I think, feel optimistic that we're moving in the right direction. I don't think we are at the finish line yet, and it's important, I think, to build on this momentum. One of the key areas that we still need to sort of catch up is compensation for peer recovery specialists. It's not yet on par with the other paraprofessionals that you've listed. So I could take a stab at this, updating it for 2023.
Thank you so much, Mr. Schoen. Appreciate your offline work in this revision so that we can entertain it at our next meeting. Wonderful. Last recommendation is recommendation 16, increase school-based mental health professionals through a multidisciplinary cross-department school-based behavioral health team.
So Chair
Open
Johnson.
to discussion. Yes, thank you.
Eric Schoen for the record. Just as a matter of principle, super, super important. I know that there's progress being made. I do feel like, and without having them in front of me, I'm just going by memory, which is not as good as it used to be. But I think we have this kind of covered in 2023, at least some portion of recognizing that we have to pay attention to the whole person, the whole child, all aspects of that. So I don't know that we need to continue this specifically, as long as we are continuing some focus in 2023 through our goals of paying attention to social, emotional, mental health, substance abuse, all that. Yeah.
Thank you, Mr. Schoen. So to summarize, it sounds like we will move on from recommendation 16 in this particular year, but just really recognizing the importance of this work as a baseline. Great, thank you. I think we got through everything. So thank you, subcommittee, for your insight and input. This, I think, is very helpful for our subcommittee to understand the scope and breadth and the number of recommendations that will come out with this year. I am just as a brief reminder that all the recommendations submitted will need to include the justification, research links, how they align with any special populations impacted, action steps, if there's an anticipated fiscal note, urgency and impact of the recommendation. And for anyone resubmitting, if the information is the same or similar, we can use that annual 2022 report to build from as you look to revise these recommendations. Please do your best to not leave any section blank. And if you could complete the survey as soon as possible, I know that that will help our SEI team members. Thank you in advance to folks who signed up for additional resubmission and revisiting of these recommendations. With that, we'll move to agenda item number 5, which is the 2023 Prevention Subcommittee recommendations for review and discussion. Ms. Rodriguez, can I turn this over to you to discuss a little bit about the impact and other areas for input?
Yeah, thank you. Emma Rodriguez for the record. So in between the July meetings and this one, the SURG subcommittee chairs met and determined a way to try to get to the impact, capacity and feasibility of implementation, urgency, not through using a number scale, because that's what had been on the surveys before. But and Chair Johnson, you were in, one making some of these points, so please fill in. But I think the thought was that people tend to rate their own recommendations all with the highest numbers. And it's also, what does the 3 actually mean versus the 2? And so they thought that it might be best to instead have the subcommittees just have a discussion about these recommendations and outline with their own words what the impact is of the recommendation, how the recommendation advances racial and health equity. So that was kind of the thought behind this exercise. So there are 3 current 2023 prevention recommendations, and so I think that's the plan with this agenda item.
Chair Johnson, can I ask so thank you for that explanation, Ms. Rodriguez. I would be curious, Ms. Johnson, what was that exercise like from your perspective? Was that helpful?
Oh, thank you for your question, Mr. Schoen. That's the exercise we're going to work on today with some of our remaining time, hopefully. So we took the opportunity to just identify that perhaps moving from a number-based system, as Emma mentioned, to more of a qualitative input, so that as this moves to the larger SURG subcommittee and folks look to rank some of these recommendations at a larger scale, that they would be able to revisit some of these key indicators that we've discussed.
Okay.
So hopefully we'll have some time to work on that today. Or at least for the prevention one, the prevention ones. And Ms. Rodriguez, do you want to move to the next slide?
Yeah, so the first one, and this is the recommendation that I heard being referred to quite a bit in the last agenda item, is around recommending to DHHS or whoever oversees those dollars to double the amount of investment in primary prevention program every 2 years for ages 0 to 24. And this is where we have been working with DHHS staff. Some of them, I believe, are on the call right now to do a presentation around how this funding works. That is expected to happen at the September subcommittee meeting. So Chair Johnson and I were thinking that maybe we wouldn't walk through that exercise in this meeting. It would rather happen at the next one after that presentation when everybody has all of the information available.
Yes, thank you, Ms. Rodriguez. So my recommendation is that we don't start with number one so that we do have the opportunity to consider the input from the state experts on this particular recommendation in case the committee wants to entertain any revisions, and then additionally identify impact in other areas, but to move to recommendation number two to work on this exercise for today. So recommendation number two, we heard a presentation at our last prevention subcommittee meeting from Malcolm Allo around tobacco and tobacco control. And again, as a reminder to our subcommittee that the SURG does entertain substances other than just opioid specific recommendations. So in Attorney General Ford's, I believe, January meeting, charged subcommittees to expand beyond just recommendations around opioids and overdose. So in recommendation two is to allocate tobacco control and prevention funding using the local lead agency's model to reach a $2 per capita recommended funding using a combination of funding sources that are identified here. So hoping that we can just speak through the information on the handout that was prepared around these areas of impact, capacity, and feasibility for implementation, urgency, or how the recommendation achieved racial equity.
Chair Johnson, Eric Schoen for the record. Just for some context, do we have an approximate figure for how much we are currently allocating per capita? Like is $2 100% increase, a 200% increase? It would be good to know the magnitude compared to what we're currently funding.
Yeah, thank you, Mr. Schoen. What Mr. Allo presented at the last meeting is that the $2 per capita funding would bring the total for tobacco control and prevention statewide to 6.2 million in Nevada, and it would move Nevada's national ranking for tobacco control and prevention funding to 24th instead of its current position at 47th in the nation. And CDC recommends that states fund tobacco control and prevention at 30 million to mitigate morbidity and mortality.
Did you say 30 million or 3 million?
I said 30 million.
30 million, okay.
So for this particular recommendation, I'm referencing the additional handout that is posted on the SURG website. Ms. Rodriguez, the SURG Prevention Subcommittee Harm Reduction Recommendations handout from August 2023, is that correct?
Yes, that's correct. So just to give everybody a little bit of background on that, this pulls together all of the recommendations that have been submitted for 2023, and it includes the full survey response. In some cases, these recommendations have been revised either through a subcommittee meeting or a subcommittee member resubmitting a survey. So it includes all of the responses and what you want to pay attention to. So for this one in particular, it's on page 8 of that handout. where it says prevention recommendation number 2, that is the most current form of the recommendation, which is also what you see reflected on the slide.
Fantastic. Thank you so much. Ms. Nadler, I see your hand up.
Yes, thank you very much. Under the recommendation 2, I see that includes vaping as well. Is there a way to add marijuana to this? Because I've done a study. I mean, I've pulled up numbers and everything, and it looks like more of these kids are smoking marijuana as opposed to cigarettes. And as a matter of fact, we have under NRS 389.033, we have a development of list of curricula and programs concerning prevention of substance misuse and substance use disorders through that NRS 389.033. And it talks about tobacco, cannabis, catch my breath. It has all sorts of programs in it. If anybody has ever seen that, I just think somehow marijuana needs to be included in this. Do you remember when we had that last conversation, he was going to give us the number of when he was talking about vaping, how much of that involved marijuana?
Yeah, thank you for your question, Ms. Nadler. I know Ms. Rodriguez and the SEI team has been working offline to set up an additional presentation to answer these particular questions, and scheduling hasn't permitted it yet to date. So working to address that. I believe in Mr. Allo's presentation, and I could go back and review the minutes, that he did address that question broadly, that they are seeing both tobacco products and cannabis products being used within in vaping. And so I'm happy to have that discussion additionally as we receive more information around marijuana and cannabis products. So go ahead, Ms.
Sorry, there's a question that goes with it too, and not to take away, because all substances are kickoffs, and we know that. But I thought we received some kind of funding, and I wonder if it's being used or it's run out from the tobacco lawsuits to deal with this for education in the schools and prevention. Do we not already receive some kind of funding for that?
Thank you for your question, Ms. Nadler. My recollection from Mr. Allo's presentation, and I'm looking through the information provided on pages 8 and 9, was that there is a master settlement agreement as sort of included in these example funding sources that are listed here. The master settlement, for the reference of folks on this call, is not the opioid settlement, but the tobacco specific master settlement. My understanding, though, is that the specifications around how those dollars are spent is not specific necessarily to this type of programming or funding. So happy to go back and review the minutes from Mr. Allo's presentation, but I do believe that he mentioned these specific talking points in his presentation around prevention funding. Let me see if I can look through this, or maybe someone else is scrolling through and can identify those points. Go ahead, Mr. Schoen.
Yeah,
thank you.
Schoen, for the record, my reading from the same statistics that you're looking at, and the memory cell starting to fire, is that the reason for the specific mention of tobacco is because it's so often overlooked. And you look at these different sources of funding, and indeed, even if they're tobacco taxes or cigarette taxes, $0 is going to tobacco control and prevention. So his recommendation, his emphasis was that we need to make sure that we have, if we want to have a comprehensive approach to prevention within the state of Nevada, we need to make sure that we have specific funding allocated for tobacco control and prevention to make sure that those efforts can begin to be established, to grow and complement everything else that's happening. And I think, Debbie, even though marijuana is not specifically mentioned, it is sort of covered with the other drugs and the other sort of drug funding. But because there is a focus on vaping, I think, I mean, just as somebody who kind of does this work in the communities I think we would see that it would hopefully help address vaping writ large, rather that's just whether it's tobacco, marijuana, or both. But that's my that's my memory for why this is specific to tobacco control and prevention.
Thank you, Eric. I understand. And vaping, I guess, would encompass all marijuana, tobacco, whatever. So get them to stop vaping. Got it.
Yeah, thank you
Thank
so
you.
much, Mr. Schoen and Ms. Nadler, for your thoughts. To reference the components on the Nevada tobacco revenue is in the prepared handout on the bottom of page 9, which demonstrates the incoming dollars to the state around these particular taxes or settlement funding. So to be clear, not the opioid settlement funding, but the Juul settlement specifically and the master settlement funding for tobacco, and specifically how much is allocated to Nevada tobacco control and prevention efforts within the state. So from my perspective, based on that, addressing tobacco control and prevention would have broad impact. The data cited from the Nevada Youth Risk Behavior Survey does indicate specific emphasis and work that's looking to be done in middle school, I believe Malcolm mentioned, and that they did see a decrease in vaping between years of the Nevada YRBS when they did have specific funding around vaping prevention. And as you all will recall from the presentation, that that funding had been recently eliminated. So it does seem like there is some urgency around the ability to address this recommendation as well. Thoughts from the committee?
So Eric Schoen, for the record, Chair, I agree. I think this is exciting in terms of an impact to have a level of funding that's quite a bit larger than what looks like is currently committed. It looks like maybe about $1 million. So if we're going from $1 million to $6 million, it would be interesting to see what kind of impact that could have both on depth as well as reach. So that kind of impact. From my perspective, I think vaping is one of those sort of backdoor ways that youth start using substances, and it's not always looked at as that dangerous. So if we could help to create a public information campaign, helping to highlight that vaping is not safe, it's no safer than X, Y, and Z. And in fact, here's what you need to pay attention to. I'm really interested to see the results of that. So from a capacity and feasibility perspective, I like that this seems like an accomplishable amount of funding. We're not asking for 30 million out of the gate. We're asking for something that seems reasonable and I think should be accomplishable. So I think it's a feasible recommendation to make. And I would look forward to this.
Thank you so much, Mr. Schoen. Other input from committee members in reviewing any of the information provided and detailed background from our previous presentation. All right. Hearing none, the area that I do think I'd love more discussion, and I'm not seeing it immediately available in here, does not mean that it doesn't exist, is around advancing racial and health equity. To my brief understanding, many tobacco initiatives disproportionately impact communities of color, Black, Indigenous communities of color, and would love to be able to include some of that findings from that and that information within this particular report as we move this recommendation forward. So I can look into that data and add. Emma, if folks have additional impact or other areas to add, how can we get this information to the SEI team?
Thank you, Chair Johnson. Emma Rodriguez, for the record. That was actually a question I had. I was wondering if people would prefer to either email it to me And then I can compile it and post it ahead of the next meeting. Or if you want me to add this as just a general survey question, where you can drop additional information in. Do subcommittee members have a preference on emailing it to me or submitting through a survey?
Fantastic question. Open to folks on the call today. What is your preference for detailing out this information for the recommendations? Do you prefer to just email? Thank you for being generous with your inbox, Ms. Rodriguez, or is there a preference around completing a survey? I'm not
Can
seeing
we
it.
email Debbie Nedler for the record? Can we email Emma with some of our findings?
Sure, Ms. Nadler. So Ms. Rodriguez has graciously made her inbox available. What I'm hearing is specific to items around impact, capacity, feasibility of implementation, urgency, and recommendations, how they advance racial and health equity, specifically around, I imagine, recommendation 2, and I imagine for recommendation 3 as well,
Okay.
rather than completing a
Thank you.
separate survey.
Yep, thank you.
Okay, fantastic. And thank you, Ms. Rodriguez. So subcommittee folks who have additional input around these areas can reach out with that. I just also did want to mention, as we're charged with specific populations of focus as we look at these SURG recommendations, that the work that's being done around vaping prevention does impact young persons. So any of the initiatives around youth and folks who are otherwise disproportionately impacted by substance use disorders. So to me, that also is information that goes towards impact of this particular recommendation. All right, and to be clear for anyone who hasn't been broadly involved in these discussions around recommendation 2, this isn't looking to allocate the attorney the Fund for Resilient Nevada dollars in thinking through this recommendation. This is looking at other types of funding sources, but the SURG is charged broadly with addressing lots of different types of substances throughout the state, not just opioids alone. Although we do recognize the broad impact and the work and the impact it's having on our communities across Nevada at this time. So just wanted to make sure everyone was clear on that. All right, moving to recommendation number 3. All right, recommendation number 3 is our recommendation to DHHS. This group could discuss the Office of Analytics or another appropriate entity to create a data dashboard or other type of regularly updated report on alcohol outlet, tobacco outlet, and cannabis outlet density. We have discussed this at our July meeting and July meeting, and have received previous presentations specific to alcohol outlet density. I did submit, based on the discussions at our last meeting, a revision to this recommendation number 3 to include other types of outlet densities. I believe we had spoke briefly about cannabis outlet density, but just wanting to include these additional areas. So I'll open the floor to the committee to discuss impact, capacity, and feasibility of implementation, urgency, or how the recommendation advances racial and health equity. For your reference, the subcommittee details begin on page 14 of the gathered information from the SURG Prevention Subcommittee Harm Reduction Recommendation handout.
Chair Johnson Eric Schoen for the record. This again, another recommendation that I'm really interested and excited about, because my understanding, there's no coordinated effort to collect this information on a regular basis. So especially cross mapping it with where people live would be interesting to see if we have higher alcohol and cannabis densities in communities of color versus other places, to what degree that might be. It seems like now that it's been pointed out to me, this feels like a base level of information that we need to complement the information already being collected at the state level, so that we can make better decisions about the interventions that we recommend and we implement for the benefit of people. So I think it's urgent. I mean, all the check boxes. I think this is important.
Yeah, thank you, Mr. Schoen. I recall at one of our previous meetings, we really identified this as kind of the first step in opportunities for communities to identify either additional policies or programs or other types of actions that they may take around these outlets and how correlated they are with other health outcomes. So I very much appreciate your comment.
Agreed.
Other thoughts from subcommittee members? Ms. Nadler?
Thank you, Jessica. Yeah, I'm glad you added the alcohol and cannabis and tobacco to that. Yeah, I think that's great because all three of those need to be addressed hand in hand. Thank you.
Thank you, Ms. Nadler. I just wanted to add for the record around capacity and feasibility of implementation. From my perspective, the feasibility seems very high for implementation, as there are several dashboards that already exist around data. So what I don't know is how readily available the inputs are to this, but in terms of dashboarding data, there's been multiple dashboards created for lots of statewide data that are available on the Office of Analytics website freely to the public. So I do see the capacity and the feasibility in terms of the dashboarding process to be a relatively low-hanging fruit or a high feasibility of implementation. Wonderful. Any other, Ms. Nadler, did you have an additional comment? All right. Debbie, if you're speaking, you may be on mute.
Oh, sorry. Is there a way to do that dashboard, the alcohol, tobacco, and cannabis dashboard in correlation and compare to the increase of the amount of illicit drugs being used, if this makes sense? I mean, I'm picturing it in my head. So we can see, okay, cannabis use has gone up, tobacco use has gone up, alcohol's gone up, and it's caused an upkick of the other illicit drugs, you know, to compare the two side by side to see the relation between using these other drugs that increases the use of illicit drugs, if that even makes sense, because I have it in my head.
Thank you for your question. My perception on this particular one is that it's just looking at the retail outlets specifically and not necessarily on use or utilization of these items. To my brief understanding, I do think some of that data off the top of my head is already available either on a data dashboard or report. So this recommendation is not for use data, but specifically about the retail outlet to examine the density of these outlets. I hope that helps clarify.
Yeah.
Wonderful. Ms. Rodriguez, did we set out to at least initially accomplish this, our goal for today around these recommendations?
Yes, thank you, Chair Johnson. I think we'll get the minutes done and we can place in what people described wherever there was a description around the impact, urgency, and then whatever additional responses we get in via email, we can add to that, and then we will post that in the revised handout ahead of the next meeting, and maybe folks can come to the next meeting after already reviewing it just to see if there's anything else they want to add. But hopefully if people are able to do their homework in the interim, it won't need too much of everybody's time at the next meeting, since we do need to go back and focus a lot more on this first recommendation in September with the presentation.
Yeah, fantastic. Thank you so much, Ms. Rodriguez, and thank you for the discussion today, subcommittee members. I appreciate the opportunity to work through some of this qualitative exercise as we look to prepare these recommendations to present to the full SURG. So if between now and the next meeting, I'm asking folks to reach out to Ms. Rodriguez. If you have any additional input around impact, capacity, and feasibility of implementation, urgency, or how the recommendation advances racial and health equity around recommendations 2 and 3 in lieu of completing an additional survey. Thank you. With that, we'll move to agenda item number 6, which are the harm reduction recommendations for review and discussion. So as our committee has taken on at least the review of these particular harm reduction recommendations, I am going to ask subcommittee members to individually volunteer to do a little bit of homework around these impact, capacity, feasibility of implementation, urgency, and advances to racial health equity for the harm reduction items as well, at least to get some initial input as these recommendations move forward to the full SURG. In the interest of time, I'm hopeful that we can do that offline between now and our September meeting, so the information can be provided as we move these recommendations forward. Ms. Rodriguez, did you want to move through them? Sorry, go ahead.
Yes, thanks, Chair Johnson. Emma Rodriguez for the record. We can move through them and see if there's volunteers. I just wanted to add that I think there might be 6. I don't know the exact number off the, yeah, there's 6. So if that feels like too much for the prevention subcommittee members to take on, in addition to all of the other work you're doing on your recommendations, I would note that we could also ask for other volunteers from other SURG members who aren't on the prevention subcommittee, because I know there's a lot of passion on harm reduction from people who don't sit on this subcommittee. So I think, Chair, if you agree, you all have your first pick of which ones you want to evaluate for capacity, urgency, all of that. But if there's no volunteer, then I think we can put it to the SURG working group. So this would be, again, emailing me with information on the items we just discussed to do the qualitative walkthrough for all of these harm reduction recommendations.
Fantastic. Thank you so much, Ms. Rodriguez, for clarifying for the committee how to move forward on this. So we'll pause briefly here in case there's a burning desire from folks on the committee to jump in for qualitative input around those indicators for piloting and evaluating the use of the quote Bad Batch app. And then the second one is around establishing a statewide initiative for community drug checking.
And Chair Johnson, if I may.
Go ahead.
Emma Rodriguez for the record. I believe at the last joint task force meeting, there was discussion around the Bad Batch app. I wasn't there, but I believe actually you presented on it. And I heard from SURG Vice Chair Lisa Lee that this recommendation in particular is already kind of in effect, so it might not need to be part of this year's annual report.
Yeah, thank you, Ms. Rodriguez. I was tasked with the opportunity to present on Bad Batch apps and was grateful for the hard work of the SURG Prevention Subcommittee as we had discussed this at previous meetings. So was able to utilize the discussions and the minutes from those discussions in addition to this recommendation in the joint task force presentation. It's my understanding that the joint task force, which is the ACRN and the SURG, as you all know, is moving forward to support broadly the implementation of the SOS app, which is the type of batch app that's being used up in the Northern Nevada Harm Reduction Alliance region up north. And one of the ACRN committee members, Dr. Carla Wagner, identified an opportunity to add some evaluation questions to an ongoing research study to understand the implementation and effectiveness of these types of applications. So it doesn't sound like at this time we need volunteers for number 1. So if there's someone who wants to take on the recommendation number 2. If not, there are 6 of them, so stay tuned for 3 through 6. All right, not hearing any immediate volunteers for number 2. We can go to the next slide. So number 3 is around harm reduction shipping supply, providing for travel costs across the state and increasing advertising about shipping programs for harm reduction supplies. And number 4 is support for harm reduction-based post-overdose outreach with public safety.
Can we quickly review 5 and 6 as well?
Correct. Yes, absolutely. We'll review 5 and 6. They are creating a bill draft request at the legislature to change the language around drug paraphernalia as it relates to smoking supplies. And 6 is providing support to community coalitions to support community health workers for expanding harm reduction.
So specifically, if we've, I got to be clear when I'm volunteering myself, what is it that you're expecting of a volunteer?
A fantastic question, Mr. Schoen. I imagine other subcommittee members are curious as well. That between now and the next meeting, for the item that you volunteer for, you'd complete you'd draft up or be prepared to share with the subcommittee or give to Ms. Rodriguez in advance of the meeting the impact, capacity, and feasibility of implementation of the recommendation, the urgency, and how the recommendation advances racial and health equity. And I imagine Ms. Rodriguez can follow up with the committee with those indicators. Sorry, go ahead.
No. I'm happy to volunteer for number 6.
Wonderful. Thank you so much, Mr. Schoen. Emma, I'll volunteer for number 5. And it's okay, other subcommittee members, if don't have input. So 2 or 3 or 4. I'll just pause for a moment, not to peer pressure anyone. Go ahead, Ms. Nadler.
Can you go back to number 3, number 3? Can you
Number 3.
Go back a slide, yeah.
Number 2, perhaps? I think we're on 3 and 4.
Number 2.
Yeah.
No, that wasn't it. Well, hang on a second. I'm so sorry.
That's okay.
It was something about, no, it wasn't 1 or 2.
Was it number 4?
It had to do with resources for overdoses. Yeah, number 4. We had talked about that in the cross-sector meeting. And that was one of my questions. Were we talking about fatality overdoses or combination of overdoses, the family members affected by the fatalities? Or are we just going to limit it to the family members that are dealing with those surviving overdoses?
Yeah, fantastic question. And just to clarify, the recommendation from the cross-sector task force is different from the SURG harm reduction recommendation that you see here. So to your point, this one does include wraparound services for family members and or post-mortem services for families as it's conceptualized.
I can try to do that one.
Thank you, Ms. Nadler. I appreciate that.
Okay.
And trying to do is fantastic. So thank you so much
Okay.
for the time you spend on that. Wonderful. Emma, I'm seeing at least 3 of the, well, at least 4, I guess, of the recommendations covered by Prevention Subcommittee members.
Yeah, thank you, Emma Rodriguez, for the record. So I don't know if I'll send it or if Dr. Kearns will out to all the SURG members to see about if anybody is able to produce something for recommendation number 2 and recommendation number 3.
Thank you so much. And thank you in advance to the SURG Prevention Subcommittee members who volunteered to do some additional quote unquote homework offline so we can be prepared for robust discussion at our next meeting. I really appreciate your participation and willingness to do the extra legwork. With that, we can move to agenda item number 7. Oh, sorry, Ms. Nadler, did you have another item for agenda item 6?
Well, kind of. We just got a new questionnaire on when our next meeting will be, and I assume it's to present all this that we're talking about. The 25th is Yom Kippur. It's our most religious holiday, and I'd like to be at the meeting so I can present what I'm presenting, but there's no way I can attend on the 25th. If possible, if anybody is good for the other dates. If not, I won't be able to attend. So I can't present what I want to present, I guess.
Thank you, Ms. Nadler. I believe the SEI team is still looking to identify a finalized date, but is very much taking your input into consideration. So thank you.
Thank you.
Yeah, no, thank you for prioritizing that for our meeting. I really appreciate that. All right, wonderful. As Ms. Nadler mentioned, we're looking to identify the next SURG Prevention Subcommittee meeting, so look forward to that announcement. But I'll move on to agenda item number 7, which is public comment. Ms. Rodriguez, I'll turn it over to you. Do we need to read anything else, or are we able to just move right into public comment?
I don't believe we have to read it the second time. So I'm looking right now on my screen. I'm not seeing anybody indicating that they need to provide public comment. I'll just pause for a moment. Yes, Chair Johnson, I'm not seeing anybody indicating they wish to provide public comment. Oh, I see Debbie Nadler has her hand raised.
Sorry about that. Jessica, could you give us the information again for the International Overdose Awareness Day event, which is this Thursday, I believe. I couldn't find the link to it. I wanted to share it.
So Ms. Rodriguez, I'm recognizing myself for public comment. I don't exactly know how that works, but apropos of nothing, Thursday is International Overdose Awareness Day, and the Southern Nevada Harm Reduction Alliance is hosting a meeting or hosting an event in Clark County from 4 p.m. to 7 p.m. at the Chuck Minker Sports Complex in Las Vegas. They'll be doing naloxone training and hearing from community members with lived experience. This is titled as Often a Time to Remember and a Time to Act. So an opportunity to recognize those that we've lost for overdose and to take action to prevent a future overdose. If anybody is interested in receiving the flyer, I'm happy to share that with you. You are welcome to reach out to me on email or by phone. Thank you. Any other items for public comment?
Chair Johnson, I do not see anybody else raising their hand.
Wonderful. With that, we'll move to, sorry. Agenda item number 8, which is adjournment. Thank you so much for the meeting today and to the fantastic members of the Prevention Subcommittee and our wonderful SEI team for coordination and preparation of the meeting.
Thank you. Awesome job as usual.
Take care, everyone. Thank you.
Thank you.